Hey guys, so today we're going to go over the muscles. So the muscular system consists of only the skeletal muscles, and the organization of the muscles will affect the power, range, and speed of movement, meaning the position of the muscles and how many muscles are there to support, say, the prime mover, which would be the muscle that's responsible for the main movement or action. So skeletal muscle fibers form bundles called fascicles, as we discussed in the prior chapter. Muscles are classified based on patterns of the fascicle arrangement, and that could be either parallel muscles, convergent, pennate, or circular, and we'll look at these in a second. So with parallel muscles, the fascicles are arranged in parallel fibers. Some can be flat, others can be cylindrical. An example of a parallel muscle would be your biceps brachii. The tension developed during the contraction depends on the total number of myofibrils that are present, not the number of muscle fibers. It's how many myofibrils are sort of packed into the muscle fiber. So this would be an example of a parallel muscle, and here you can see all the fibers are just elongated and parallel. Here's another one. This is actually your rectus abdominis muscle, or more commonly referred to as your six-pack abs, and you can see these are also parallel muscles. Here's another one, your biceps here, and you can see these parallel fibers. I'm sorry, this is your supinator muscle, not your biceps. Also parallel fibers there. Convergent muscles, these are when the muscle fibers spread out like a fan, converging. An example, this would be your pectoralis muscle. The muscles may pull on a tendon, they might pull on a ponderosus, or they might pull on a slender band of collagen fibers called a raphe. The fibers will pull in different directions depending on the activity. And here you can see this is an example of this actually your pectoralis muscle. You can see how it sort of fans out, okay, the fibers. Pennate muscles, these are muscle fibers that pull at an angle relative to a tendon. Compared to parallel muscles, pennate muscles do not move their tendons as far. They contain more myofibrils, and they will actually develop more tension. And the pennate muscles can either be unipennate, which means they are all on the same side of the tendon, bipennate, which means they're on both sides of a central tendon, and multipennate, which means tendons, branches within the muscles. So here is a unipennate muscle. This is the extensor digitorum, which is located in your forearm. You can see the muscle sort of coming, radiating off of the one side of the tendon here. There's a bipennate on either side of the tendon. This is your rectus femoris. And then a multipennate here, you can see here. And then you can also see, if you do a cross section, you can see the multiple tendons within the cross section there. The fourth class is, or fascicle arrangement, is actually circular muscles or sphincters. These act more like valves, especially in the digestive and urinary tracts. They will surround body openings and hollow organs, and the contraction makes the diameter of opening smaller. When the muscle contracts, the opening will actually become smaller. So this is the orbicularis oris muscle. You can see it's contracted here. This is its relaxed. You can see the opening is smaller when it's contracted. And this is a type of muscle where you have the concentric rings that sort of go around. Now, all skeletal muscles are going to, almost all skeletal muscles will be attached to bones. The site of connection to a bone affects the force, the speed, and the range of the movement. Each bone will act as a lever, which is a rigid moving structure. Each bone will move on a fixed point. Each muscle will move on a fixed point, which is the fulcrum, when the muscle provides applied force to overcome the load. And each joint is a fulcrum. So levers can change the direction of an applied force, the distance and speed produced by an applied force, as well as the effective strength of the applied force. And all three of these things can actually apply to the movement of muscles. Origin insertions are a term that you oftentimes see with skeletal muscles. The fixed point of attachment of muscle to bone is referred to as the origin. The movable point of attachment is referred to as the insertion. The origin is usually proximal to the insertion. Don't worry, I'm not going to make you guys know the origin and insertions of the muscle attachments. If any of you are going into, say, physical therapy, that is something when you take your advanced anatomy course with your dissection lab, you'll need to know the origin and insertions of the muscles. And I'm not even sure if med school gets into that level of detail. But I know for PT, that is something that they do look at. Actions, movements produced by muscle contraction. That's how the actual movement occurs, is by the muscle contracting. And examples of movements could be adduction, elevation, pronation. We'll see a list of terms in a few minutes. They can also be described in terms of the effect that they actually have on the bone or the joint. For example, flexion of the forearm or flexion at the elbow. Muscles can also have interactions with other muscles. You can have an agonist, an antagonist, a synergist, and a fixator. So an agonist is the actual prime mover. This is the muscle that's mostly responsible for producing a particular movement. Typically, an agonist is going to have various synergists, which are smaller muscles that will assist a larger agonist. Now, muscles only pull, they don't push. Because muscles only pull and do not push, typically what happens is whenever you have a muscle that performs an action, you have to have another muscle that reverses that action. And the reversal is most likely going to be an antagonist, which will oppose the movement of a particular agonist. So, for example, the muscles involved in flexing the arm, the antagonistic muscles would be extending the arm. Fixator, this is a synergist that assists an agonist by preventing a movement at another joint. So it sort of fixes the muscle in place. So muscle opposition, agonists and antagonists work in pairs. When one contracts, the other stretches, such as flexors and extensors, or abductors and adductors. Okay, so let's look at some of these movements, flexion and extension. Okay, if we look at the flexor, this is your biceps brachii is going to flex at the elbow. The extensor is going to be the triceps. When that pulls, it's actually going to extend the arm. Okay. Abduction, adduction. Adduction is bringing a structure closer to the midline. Abduction with a B is moving a structure away from the midline, so moving it more laterally. Medial and lateral rotation. This is just, are you rotating medially towards, are you rotating medially inward or laterally outward? Okay, and this is something we see in our arm with medial and lateral rotation of the arm. So the body actually has approximately 700 skeletal muscles, and although the list may look extensive for you guys, you only need to know a small number of those. The names of the muscles include descriptive information about the region of the body, the position, direction, or fascicle arrangement, structural characteristics, or potential action. So there's a lot of information sort of built into those names, and you might be able just to look at a name of a muscle and know exactly where it is and what it's doing. That's not the case for all of them, but for some of them that is the case. Just make it simple and look at the name and know what's happening. Terms indicating specific regions of the body. This is kind of going a little bit back to chapter 1, just to sort of refresh you on some terms of some terms, abdominal means the abdomen area, ancon is elbow, or auricular is ear, brachial is arm, capitis is head, carpi is wrist, and cervicus is neck. Coccygeal is coccyx, costal is rib, cutaneous is skin, femoris is thigh, glossal is tongue, hallux is great toe, ilium is groin, inguinal is also groin. So you'll see some of these names incorporated into the muscles, and they're just sort of directing you to specific regions of the body here. Lumbar is lumbar region of the back, nasalis is nose, ocular is eye, oris is mouth, palpebra is eye, lid, pollex is thumb, popliteal is posterior to knee, and psoas is the loin area. Radial, forearm, think of radius, scapular, scapula. Temporal is the temple region, your temporal bone's right here. Thoracic is the thoracic cage. Tibial is shin, tibia, think of tibia. Ulnar, think of ulnar. So again, a lot of the regional names will actually be part of the actual name of the muscle. Position, direction, and fascicle arrangements. Externus or superficialis, this means that it's visible on the body surface. Internus or profundus, this means that it's a deeper muscle, something that's not necessarily visible on the surface. Extrinsic muscles, these will position or stabilize an organ. Intrinsic muscles would be located within an organ. Transverse muscles, these run across the long axis of the body. Oblique muscles run on a slant to a long axis. And then the rectus muscles, these are going to run along the long axis, such as the rectus abdominis going straight up and down. Then you also have, you'll see anterior, posterior, lateral, medial. So again, a lot of the directional terms will also be incorporated here. Again, these are just some more of the directional terms there. Okay, so the first part of the name typically indicates the origin. The second part will indicate the insertion. So the genioglossus, the genio is going to indicate the origin. The glossus would indicate the insertion. You can also have the number of the tendons that are present. So for example, the biceps brachii is going to indicate attachment points at two places, biceps. Also, the name might indicate a shape, okay, such as trapezius, deltoid, or rhomboid. Nature, the origin, biceps refers to 2 heads, triceps is 3 heads, quadriceps is 4 heads. Here are some more shapes and defining those shapes. So again, I know it's a lot of terminology here. Just again, some of these terms we've seen in the first chapter, but it is worth just taking a few minutes to look through some of these terms, most of which you probably know just off the top of your head or make sense to regional areas of the body. But again, it's something you don't know, just sort of think about it, okay? And again, here's some more shapes, okay? And then some other features. Size, magnus typically means large, major means large, maximus is largest, minimus is smallest, minor is smaller. Okay, so just, again, it's also based on some shape there. Naming could also involve the action. Flexor, extensor, pronator, this will actually be right there in the word. So let's look at some of the general actions that we can see with muscles. They're defined here. Abductor, adductor, depressor, extensor, flexor, levator, pronator, supinator, and tensor. Okay. And again, a lot of these were defined in chapter 1. Buccinator, this is your cheek muscles. This is the trumpeter muscles. Rhizoris, laughter. Sartorius, like a tailor. Okay, straight down. Okay. So let's look at the various divisions of the muscular system. The axial muscles, 60% of the muscles are going to fall in the axial muscles. And again, this is just like the skeletal system. So this is going to include the head and the vertebral column. These are also muscles that are going to be involved within the rib cage and also form the pelvic floor. And then you have your appendicular muscles. These will move and support the pectoral and pelvic girdles and the limbs. So these two images here, these are very important, as these are pretty much most of the muscles that you need to be able to identify structure-wise. Now, again, this is not on the lab practical that's coming up. This is actually on your second lab practical. So you might not look at this just right now, but this might be something you might look at a little bit later on. But these are the superficial muscles, and you'll need to know these lower half right here, posterior side and lower side. So this is these 4 pages, print these out, keep these with you. Also, in the atlas, when you're looking up that, these are the muscles that you need to be able to identify as far as structure is concerned. Okay, so very, very great figures here that I would keep handy. Okay, so the axial muscles, these are grouped based on location and function. These are going to include muscles that are involved in the head and neck, muscles of the vertebral column, your oblique and rectus muscles, as well as muscles of the pelvic floor. Okay, and I'm going to cover the axial muscles in this recording, and then the next recording will include the appendicular muscles. So muscles of the head and neck, these are muscles that will be involved in facial expression, mastication, which is chewing, movement of the tongue. Most of these muscles will actually end in the word glossus, which means tongue, and muscles of the pharynx, which will begin the swallowing process. This will also include muscles that move the eye, and these are referred to as your extrinsic eye muscles, and there's actually quite a few muscles that will move the eye in various directions, and also to help control the position of the eyes. And then muscles of the anterior neck. This will control the position of the larynx, depress the mandible and tense floor of the mouth, and support the muscles of the tongue and the pharynx. Muscles of facial expression. Let's start there. We have the orbicularis oris. This will constrict the mouth opening. And that muscle is located right around here. Then you have your buccinator muscles. These are your cheek muscles. They help to move food across the teeth. And also in infants, they provide suction for nursing. Muscles involved in facial expression. This is going to be the temporal parietal muscle and the occipitofrontalis muscle. Okay, and these are the muscles that are going to be pretty much on the scalp, this whole part of your head here. And they overlay the bones that are part of the name here. The platysma, this will cover the anterior neck surface. So the front neck surface, like right here. So let's look at some of these. Okay, so here we have our frontalis muscle. The occipitalis muscle will be back here. We then have the temporalis muscle. The parietal muscle will be actually a little bit further up here underneath the frontalis and occipitalis muscles. And the buccinator is right here. Again, this is your cheek muscle. The orbicularis oris right here. And then the platysma is cut right here, sort of cut down, but this would sort of be on the exterior surface of, say, the sternocleidomastoid and your hyoid muscles, which are all deeper to the platysma here. So here you can see a little bit better. Here we can actually see the platysma. All right, frontalis muscle again right here, temporalis muscles right here. Okay, orbicularis oris. Muscles that move the eye. We have the inferior rectus, medial rectus, superior lateral rectus, and then the inferior and superior oblique muscles. So there are 6 muscles that are responsible for ocular motor movements or movement of the eye. Here we have the lateral rectus. It's going to be on the lateral side. Your superior rectus is here, superior oblique here, inferior oblique, and inferior rectus. This is the inferior oblique right here. This is the inferior rectus. So your rectus ones are the ones that are going straight back, okay? Lateral rectus, superior rectus. There's a medial rectus on the other side. Inferior rectus. Your oblique muscles are going to turn the eyeball in a rotation this way or that way. This is looking at the medial rectus. So this is actually now cut. This is a medial view. Okay, so they essentially cut straight down, exposing this. All right, so you're not looking at the side, you're actually looking at the medial view. The nose would be the next structure outward here. And again, here you can see superior, inferior, lateral, medial, rectus, and those are going to be the movements. Your superior oblique is going to rotate the eye in this manner. The inferior oblique is going to rotate the eye in this manner here. So you go either this way or this way. Muscles of mastication. Masseter, this is the strongest jaw muscle. The temporalis, this will help to elevate the mandible. And then your pterygoid muscles will elevate, depress, and protract the mandible. The pterygoids, if one side does contract and the other does not, this allows for side-to-side movement. So here we've removed some of the superficial muscles. We see the temporalis. Here is your masseter right here. Okay. And then you have your pterygoids on either side. And again, this allows for sort of a side-to-side movement of your jaw. Muscles that move the tongue, they're all named for the origin and insertion. So you have, and again, for these, collectively just know them as the glossus muscles. It's palatoglossus, styloglossus, genioglossus, and hyoglossus. And again, I'm not going to specifically ask you to identify these, but if I kind of pointed to one of these, you should know that these are one of the glossus muscles involved in movement of the tongue. Muscles of the pharynx. You have your pharyngeal constrictor muscles. These will move food into the esophagus. The palatal muscles. These will elevate the soft palate and adjacent portions. They will also pull open the entrance to the auditory tube. And then you have your laryngeal elevators. These will raise the larynx. And here you can see your various palatal muscles right here, here, and then your pharyngeal constrictors right here, here. Muscles in the anterior neck, which is the front part of the neck. You're going to have your hyoids, and there are several different hyoids. But before that, we have our digastric. This will control the position of the larynx. It extends from the chin to the hyoid bone, and from the hyoid to the mastoid portion of the temporal bone. The mylohyoid, this will elevate the floor of the mouth, and it will also depress the jaw. The geniohyoid, this will extend between the hyoid bone and the chin. The stylohyoid, this is between the hyoid bone and the styloid process of the skull. You then have the sternocleidomastoid, which extends from the clavicle and the sternum to the mastoid. The sternocleidomastoid is actually going to turn the head obliquely to the opposite side. Okay. Then you have your omohyoid, which will attach the scapula, clavicle, first rib, and the hyoids. And if we look here, we can see a lot of the hyoid bones here. Again, all nestled around the hyoid bone. Okay. Again, I'm not just collectively know them as the hyoids. The one I did want to point out, though, was the sternocleidomastoid here, which is here and here, and that's this muscle here. Again, if this muscle contracts, it's going to pull the head down one way or pull the head down the other way. If they both contract, it's like you're looking down. The muscles of the vertebral column, you have your erectospinal muscles. These are going to be both superficial and deep layers. And then you have your spinal flexors. The erector spinal is going to allow for extension of the spine, okay, versus spinal flexors, which will flex the spine. So your erector spina group, this will include the spinalis, longissimus, and iliocostalis groups. You should know that those three groups make up the erector spina muscles. Then your deep layers, you have semispinalis group, multifundus, interspinalis, intratransversari, and rotatorius. The only one there that I'm concerned that you know of is the semispinalis group. These other four kind of collectively fall under that particular group. So looking here, again, if you look at the erector spina muscles here, you have the spinalis, longissimus, and iliocostalis. And then deep layer, you have the semispinalis group, okay? Which is going to be here, here, and here, okay? But your others are here, here, and here. Okay, these are all part of the erector spina muscles, and when they contract, you're going to sort of sit up at attention. Your spinal flexors, the longest capitis and longest colli, these are going to rotate and flex the neck. And then you have your quadratus lumborum. This will flex the vertebral column and depress the ribs. Okay, and looking at a posterior view here, we can see these various muscles. So here's your quadratus lumborum here. Okay, and then these are your longus colli muscles. Oblique and rectus abdominis muscles, these will lie within the body wall. The oblique muscles will compress underlying structures. They'll also rotate the vertebral column. The rectus abdominis muscles, or rectus muscles, will flex the vertebral column and oppose the erector spinae muscles. With your oblique muscles, you have your scalene muscles. This is going to flex the neck and elevate the ribs. In the thoracic region, you have your external and internal intercostal muscles. This is sort of the meat in between the rib bones. And then the transverse thoracic muscle. This is going to cross posterior surface of the sternum. Looking at the oblique muscles, you have your external oblique, internal oblique, and transverse abdominis. You also have the rectus abdominis muscles, which is going to be your primary flexor at the abdominal cavity there. And then finally, we have the diaphragm. This is the major muscle that's used in breathing, and this is actually going to be a huge muscle that forms the floor of the thoracic cavity and the roof of the abdominal cavity. All right, so let's look at some of our scalenes. Again, here is our sphenoid bone here. You can see the vertebral column. You can start to see some of your rib 1, rib 2 here, okay? These are your scalenes on either side, all right? So just, again, when you're trying to figure out the actions of these muscles, envision these fibers shortening up. What are they going to pull on? How is that structure going to move? All right, our internal and external intercostals, these are the muscles that are found within the ribs here, okay? Here are your abdominal muscles. So we have the external oblique muscle here. Then you have the rectus abdominis muscle here. Next to the rectus abdominis, you're going to have your internal oblique, okay? And then we just talked about the internal and external intercostals. Here's the diaphragm. So this is going to essentially form that barrier between the thoracic and abdominal cavities. All right. Muscles of the pelvic floor, they're going to function to support the organs of the pelvic cavity. They will also flex the sacrum and the coccyx. They will control the movement and the materials through the urethra and the anus. So the perineum, this is the region that's bounded by the inferior margins of the pelvis. It's divided into the ischial tuberosities and into, on the anterior side, the urogenital triangle, and on the posterior side, the anal triangle. The pelvic diaphragm will form the muscular foundation of the angled triangle, and the pelvic diaphragm will actually extend all the way down to the pubic symphysis. So the perineum, this is the urogenital and pelvic diagrams. They do not completely close the pelvic outlet. The urethra, anus, vaginal tract in females, muscles, nerves, and blood vessels will all pass through the perineum. Sphincters will actually permit voluntary control of urination and defecation. And you have both skeletal muscle sphincters, which is voluntary control, meaning you have conscious control over those actions. But you're also going to see you have smooth muscle sphincters, and you do not have conscious control over those. So the urogenital triangle, this is going to include the ischiocavernosus muscle, bulbospongiosus muscle, and then the superficial transverse perineal muscle right here. And this sort of forms that little triangle right here on the superficial tract there. The pelvic diagram here, looking at sort of the anal triangle, which is going to be right in this area here. This is going to include the your levator ani muscles, okay, the Coccygeus muscle, and then the external anal sphincter, which is this muscle right here. So your Coccygeus, your levator ani, and your external anal sphincter will all form the anal triangle. So you have the urogenital triangle right up here, and then you have the anal triangle below. And we also see the same set of muscles in the male forming those two triangles as well. Okay, and that is your axial muscles. Again, as far as functions are concerned, you know, that table that you had to fill out for this chapter, that's going to be it for sort of the lecture exam. I'm not going to ask you to identify any muscles on the lecture exam. So by filling out that functions table, and I will actually post an answer sheet after the actual assignment closes so that you can use that to study or go over and check your answers to make sure that they are correct. That's really all you want to study for this chapter is that table, that assignment sheet. For the identification, again, you want to use the worksheet that tells you what in the atlas structures you need to know, okay? And again, it's mostly just the superficial ones.